first thing that your baby does when they come out of the womb is cry. And crying is a form of communication. So actually, infant and newborn communication, I would argue, starts from the second that you're born. And when we think about communication from a developmental standpoint, we usually break it up into two categories. Those categories are expressive language and receptive language.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Hello, we're back at Be Kind Pediatrics in the office today. Today we're going to be talking about normal infant development of language and normal language developmental milestones. For those of you who are new to the show, I'm Dr. Blair Rolnick. I'm a board-certified pediatrician and a mom myself, and I created this show to bring evidence-based guidelines and medicine and digestible ways to parent. When parents come in for wellness checks with me, one of the core areas that we are assessing and parents usually have questions about is their child's development. And traditionally, we break development up into 5 major categories: communication, gross motor skills, fine motor skills, problem-solving skills, and personal social skills. Today, we're going to focus on communication skills and specifically in those less than 12 months age. So you might be thinking to yourself, well, I didn't think that my child even had any communication skills until they were 12 months old, right? Because traditionally kind of think of first word by first birthday. That's actually not true. Language and communication skills start developing from the time that your child is born. And what I mean by that is that the first thing that your baby does when they come out of the womb is cry. And crying is a form of communication. So actually, infant and newborn communication, I would argue, starts from the second that you're born. And when we think about communication from a developmental standpoint, we usually break it up into 2 categories. Those categories are expressive language and receptive language. Expressive language is just that. It's your ability to communicate using words and express yourself to somebody else, versus receptive language is your ability to understand language that is spoken to you. And that might be sign language, verbal language. There's all different types of ways that we communicate: body language, gestures, and tones, which are both expressive and receptive. Interestingly, children develop receptive language skills before they develop expressive language skills. So most children will understand what is being spoken or communicated to them before they can communicate, at least using words, back to their parents or loved ones. What can you expect, or should you be looking for, in your child if they are 0 to 3 months old? So at this age, it's really hard to determine receptive language skills, but there are some expressive language skills that your newborn should have. First, between 0, from the time they're very born, they will learn to cry. That's our first language skill. And newborns cry for all sorts of reasons. They cry when they're hungry. They cry when they're tired. They cry when their diaper's wet. They cry when they want attention. That's their really only sole form of communication, and so it can mean a lot of different things to a newborn. The next expressive language skill that you might notice in your newborn is grunting. And so infants will often make a funny little grunting sound when they're responding to something to their parents. If they want something to eat, if they're satisfied, if they're tired, if they want to get your attention, they can kind of make a small grunting noise. So grunting usually develops around 1 to 2 months old. After grunting, we usually see squealing, which kind of sounds like a high-pitched cry, and that develops often somewhere between 2 and 4 months of age. Also, around that same time frame, you might notice cooing, which is the ooh sounds, like vowel sounds, or you can sometimes notice the babies might start to develop their own laugh. It's really hard to differentiate the squeal from the laugh, but one might be a little bit lower pitched than the other. The next big topic we're going to talk about is 3 to 6 months. So around the 3 to 6 month mark, you might actually start to notice some receptive language skills in your baby. By this, I mean you might notice that your baby responds to you talking to them, either by looking at you or turning their head and showing interest. That usually occurs between 2 to 4 months. You might notice that your baby is really watching your face. That also usually develops around 2 to 4 months of age. You might also notice that your baby makes a grunting sound in response to you talking, showing that they want to engage with language with you. Some early expressive language that you might start to notice outside of those cooing. Certainly between 3 to 6 months of age, you should start to notice cooing, laughing, and interest in trying to respond back to you with some sounds. And then my favorite expressive milestone is smiling. So usually babies learn to start smiling around the 3 to 6 month mark, closer to that 3 to 4 month mark. So at 6 to 9 months, what you can expect from a receptive language standpoint is that your child may start to recognize familiar objects like the bottle. They may start to understand very simple commands like no or hi. They may even start to notice familiar objects when named. So when you say bottle or you say mama, they might actually look for the bottle or look at mama. Very excitingly, around 6 to 9 months, babies start to babble. So babbles are the combination of consonants and vowels. So it might be ba 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 ba, ma 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 ma, la 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 la, sounds like this. The reason that we coo before we babble all has to do with the shape of our mouth. So making vowel sounds, your mouth is open wider and it doesn't require as much control of your lips. So the O sound, you can see their mouth is nice and wide open. Versus ba, you need to be able to make your mouth smaller, have tighter control of your lips. And so that's why we always see cooing before we see babbling, because it just requires tighter control of the muscles in our mouth. You might also start to notice around 6 to 9 months that your baby really enjoys conversations. And that they really enjoy vocal play. So they might make loud noises back at you or squealing and giggling sounds back in response to your smiling and giggling. So language really starts to explode for most children's development in that 9 to 12 month mark. So let's take a deeper dive into what's normal communication development for those age groups. So you may start to notice, again, from the receptive language standpoint, that your child now understands simple commands like come here, wave bye-bye, no, look, those kinds of 1 or 2 word, very simple commands. Your child may look for objects that you hide, so it's really good at this age to play peekaboo or hide and seek. Your child might recognize familiar pictures if you point and say, look, or where's the bear? They might actually follow or find the object with their eyes at this point, or they may actually even point to it. You also may notice around the 9 to 12 month mark that your child responds appropriately to their name. Some expressive language skills that we see in the 9 to 12 month mark, of course, the first word, which can be anywhere from 9 months all the way up to 14 months. You might start to notice that your child actually waves bye-bye or hi. They might use their head to shake no. If you've been working on sign language with your child, usually around 8 to 9 months, your child will start to actually sign back to you. At this age, your child should also start to be pointing to the objects that they want, and they should or can sometimes shout to get what they want or to get your attention. And now I kind of want to take a special time to discuss bilingualism in children because it's such a topic that I get a lot of questions about from parents. Specifically, how does learning 2 languages affect their child's development? Are there any changes or risks that their child might have later or delayed language acquisition, and can it hurt their communication development in any way? So first, we know that language development for children who are bilingual is exactly the same as children who are monolingual. An interesting fact that most parents don't realize is actually if a child knows the same word but in 2 languages, that counts as 2 different words. I'm going to take a pause here actually and talk about what counts as your baby's first word. We count anything that a child uses consistently to call an object appropriately. So if they use baba for bottle, that is still their first word, for example. Go back to bilingualism. If a child says both hola and hello, that's actually two words, even though it's the same word in two languages. Similarly, we know children who are bilingual develop similar grammatical patterns as monolingual children. If you are going to teach your child a second language, the optimal time is actually between 0 and 3 years old, because that is when most children are developing their strongest core language developmental skills. So absolutely, if you are a bilingual household or you know a second language, please start talking to your child in that second language from the time that they are born. We also know that children who are bilingual may do what's called mixing, and that can be appropriate all the way up into adulthood. So mixing might look something like your child might say más, food, so más meaning more in Spanish and food in English. That's a very common scenario and doesn't reflect any language developmental delay or misappropriate use of language in your child. Interestingly, children who are bilingual have been shown to potentially have faster processing speeds than children who are monolingual. So there is no real harm for a language delay in teaching your child two languages, and there is potential benefit. If you want to teach your child a second language, outside of just talking to them consistently in two languages, it can also be very helpful to read in both languages and to listen to music or songs in both languages. Now I just want to wrap up this episode talking a little bit about what milestones mean, or what the term milestones means, and what you can expect for word milestones, because that's really where I get a lot of questions from parents. So a milestone means, or is a cutoff that we use from studies that we know 90% of children do this by this age. So when I say the first word milestone usually happens around 12 to 14 months, that means 90% of children say their first word between 12 and 14 months. So there will be 10% of normally developing children who do not say their first word between 12 and 14 months. So let's go over some of the milestones for words, the average words by age, and then the above average words for age. So by 12 months, the milestone would be one word. On average, children say 5 words. And on above average, a child might say 15 words. At 18 months, the milestone might be 10 words. The average is 50 words, and the above average would be 150 words. If you'd like to have a little bit of a cheat sheet to kind of check off and follow your child along with their development, I've included below a link for my developmental language checklist from 0 to 12 months old. I hope you enjoyed today's episode. I hope you found it useful. If you did find it or you enjoyed today's episode, please give us a like or subscribe.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.